somewhat unusually, but in keeping with best practice and medical advice and all of that, we do have Eamonn Shanahan with us, but he's not in studio. He's in Killarney. Eamonn, you're very welcome.
Or
Farranfore even. I got mixed up there. You're in Farranfore. My apologies.
I'm in Farranfore. I'm in the medical centre. We've been fielding calls all day here, so this is another one.
Exactly. So here anyway. You're with us in some shape or form anyway, and we can we can hear you loud and clear. Eamonn, before we come to the questions, and there's plenty for you, what's it been like for you as a GP in the last week since you spoke to us last? Because these are really extraordinary times.
They are. They definitely are. It's very different. So I suppose really the things took off on Monday this week. Monday and now again today, of course, with the bank holiday in between. I think that we made, and looking at the appointment sheets in front of me here, the appointment on the computer screen, I think we made something between 160 and 200 phone calls between us on Monday, and today we're certainly well up in similar numbers. I'd say by the end of the day we'll have probably rung about 150 people back.
My goodness. And is there a kind of a running theme through all those questions that people are ringing?
There isn't. You see, part of the problem is that, and this is really important, I mean, one of the issues we are trying to do is, and it's really important that we do continue to provide the service, but I mean, one of the things and one of the key messages that we're trying to say to people is, don't come to the surgery unless you ring ahead. Please just don't turn up at the surgery. That's really important. Having said that, the thing is that what we will be doing is we are taking information, we're ringing people back and dealing with them as they write. Some of the issues have to do with things that are unrelated, so injuries and other sicknesses and so on. But to be fair, probably 60, 70%, 80% of the queries are to do with some form of respiratory tract infection. And this morning, again, I wouldn't have an idea, but I'm guessing maybe for myself personally, I probably referred 5-6 people for testing. So I've been online and the system has been working, and I have been able to refer people online, and they will get a text to tell them to go to wherever to get the testing done. So that's really about the size of it. So as you said, just up there, the extraordinary times.
Well, let's get down to some questions, Eamonn, and there's quite a few about coronavirus and quite a few general medical queries as well.
Sure.
We'll start with one from a lady who emailed this morning. She says, I'm in my early 70s and consider myself very fit. I swim 4 or 5 mornings a week and walk daily with my dog. I'm constantly hearing that people with high blood pressure are at risk. I have high blood pressure, which is well controlled by medication. Does that mean I'm still at risk?
Yeah, and the honest answer is I don't know, but I will say this. There is a difference to me between somebody who has uncontrolled high blood pressure and somebody who has controlled high blood pressure. I do think there is a significant difference between the two things. Point being that somebody who has controlled blood pressure, quite apart from the COVID-19, should not be at any increased risk over and above somebody who doesn't have high blood pressure. In other words, though you are taking the relevant medication, if your blood pressure is controlled, that's all that matters. So it's better that you have your controlled blood pressure than the uncontrolled blood pressure.
Okay, so, well, I guess the very fact that she's over 70 anyway would still put her in the at-risk group, wouldn't it?
It does. That I can fully understand that. But at the same time, again, the thing is that I think if you listen to the messaging is, yes, there is no doubt there's a relationship between age and serious consequences from this infection, but there is kind of the subliminal message and the underlying health problems, and that's been the issue. Now, underlying health problems, the typical ones are chronic heart, lung, kidney conditions, things that are diabetes, of course, things that are either not controlled or not controlled well enough. It depends also to a certain extent on the person's general condition. And at this time, and I think it's important to repeat the message, yes, by all means, social distancing, that means please stay away, ideally 2 metres, 6 feet away from the person next to you. You're still hearing of people going around in groups. Not a good idea, folks. But the thing is that, and I said it last week, Deirdre, in County Kerry, so Jesus, if we've got anything, lads, we have loads of room. Get out and take advantage of the facilities we have across the county. The reason I'm saying that is eat sensibly, eat healthily, exercise regularly, don't smoke, and drink in moderation. There is some evidence coming through, unfortunately, that people who are smokers and those people who vape are at increased risk as well.
Now, a listener says, if you're on, now again, excuse my pronunciations, Eamon, it looks like infliximab infusions.
Infliximab, yeah.
For ulcerative colitis.
Okay.
Does that put you in the risk group?
Okay. The honest answer again is I've been hearing some mixed messages about that. The people who will be able to give you this specific advice about that, and they're the ones you should turn to. Infliximab is prescribed by the relevant specialist, usually a gastroenterologist. In many cases, those specialists do have specialist nurses who are working for them. They will be the people who will be able to give the information on that.
Now, a Killarney lady in her 70s, she lives alone, and she says, if she thought she had the virus, we'll say on a Friday evening or a Saturday morning, who should she contact, or would she have to wait until Monday? She doesn't use the internet, and they're being advised not to contact South Doc.
Well, yes and no. No, the answer is that I think that's important to put that one to rest. The thing that South Doc can't do is, so if I was on for South Doc and one of my colleagues, well, in fact, both of my colleagues were on for South Doc yesterday on St. Patrick's Day, on South Doc can't order the tests for you, but for people who have any concerns about their health, please do ring South Doc. Now, I'm aware of the fact that on yesterday afternoon, the South Doc system did go down, the phone system did go down under the number of calls that came through. But having said that, the thing is that the out-of-hours service, to remind people again, South Doc is an urgent out-of-hours medical service. Urgent meaning it's something that can't wait till the following day, out of hours by definition, and it's a medical service. If people have what we call a blue light emergencies, so if somebody has a collapse or somebody has chest pain or they've broken something, that's call the ambulance, go straight to the hospital. But in cases where people have the normal things like cough and colds and stuff like that, and they're feeling unwell, yes, do please ring South Doc. To be fair, the service is under heavy pressure. Again, because it was a bank holiday yesterday in the middle of a working week, that was a particular issue, and I've no doubt that next weekend South Doc's going to be very busy again. But again, to repeat the message, that's what South Doc is there for.
A lady in her late 70s with heart disease says, I'm staying out of the shops at the moment, but is it okay to go out and walk my dog?
Absolutely, and that's what we want people to do. The thing is that we want social distancing, but we're hugely conscious of the fact that social isolation, or rather the fact that people can get isolated, is something we want to try and avoid. And to be fair, Deirdre, we are hearing all sorts of really good news stories all over the place of people going the extra mile in terms of keeping in contact with individuals who are known to live on their own, people just ringing them up spontaneously saying, are you okay, is there anything I can do for you, and that kind of stuff. But equally, for people to be able to get out and around. And also, to be fair, to the supermarkets, they're also making facilities available so that people can go in the earlier morning, people who might be at risk, so they can do their grocery shopping when there are less crowds around.
Now, Tom in Tralee has a very interesting question. He says, currently a lot of people are experiencing symptoms of ordinary winter flu and head colds, which are clearing up after a week or so. Down the road, will it be possible to find out from blood test markers if the symptoms they had was in actual fact a mild form of COVID-19 rather than the winter flu?
And that's a very fair point. I think what we have to work on, Deirdre, right now this minute is that anybody who's got respiratory symptoms really has COVID-19 until proven to the contrary. I'm sure everybody's seen the video at this stage of the line of matches and the person stepping out and breaking the chain. The thing about it is that we have to assume, until proven to the contrary, that anybody who has respiratory symptoms has COVID-19. And our message, and the message I'm putting out to the patients I hear from this morning, if they have a respiratory system, I'm telling them, I'm directing them to the HSE website where there's really good information on this, but I'm talking about them isolating themselves for the duration, and we're looking at perhaps up to 2 weeks. Now, they will need to go to get their testing done, but otherwise I'm saying people to isolate themselves. There was an interesting piece in the Irish Times this morning, in the midst of the carnage that is what's happening in Italy at the moment. There was one small village, about 2,000 people, somewhere in northern Italy, and essentially what they did was they took a very aggressive attitude from a public health point of view of doing testing on everybody. And the interesting thing was the fact that a lot of people who were actually asymptomatic with no symptoms at all were actually, in fact, did have COVID-19. The point being that in this village of 2,000 people where they tested and kept checking people, and anybody who was found to be positive was told isolate themselves. They were the village in which there was actually no deaths, and there was very few cases of COVID-19. Folks, it's not rocket science. The reality is that this virus is spread it's a droplet spread. It's not something that sits in the air. It can only come by way of somebody sneezing or coughing out droplets. They land on a surface, you touch them with your hand, you put them to your face, and they can only get in through your mucous membranes. The virus cannot penetrate through your skin. It will get in through your eyes, your nose and your mouth. So that's the reason why we're going on about wash your hands, wash your hands, wash your hands, wash your hands. But that's how we break the cycle. The reality is at the moment we have to assume anybody who's got respiratory symptoms potentially has COVID-19, and therefore I would ask anybody who has respiratory symptoms, please do isolate yourselves.
Now, since you were talking there, Eamon, about where the virus lives, this next question from a listener says, if a person has the virus, is everything they touch infected, like their clothes, cutlery, books, etc.? Yeah,
okay. Again, you see, even there, if one is careful, and this is, again, there's some really good practical advice about this on the HSE website. The thing about it is that if you've got somebody who has the infection, right, if when they cough or sneeze, if they use a tissue to capture the bugs in the tissue and then wash their hands afterwards, but properly wash their hands afterwards, that very much minimises the transmission of the virus to the surfaces around them and onto other people. Having said that, if somebody is isolating themselves in the house, it is prudent and wise that they use their own face cloth, towel, dishes, cups, cutlery and so on and so forth.
Eamon, the next question is from a listener in Ballybunion who wants to know, are there any statistics on how many people recovered from coronavirus, especially those over 70?
Yeah, again, the reality is that the majority of people who get COVID-19 of all ages will get a mild form and recover themselves. There are statistics there. I'm trying to think. I can't think of there's a hashtag. There is a colleague of ours. If people go to Twitter and look up Professor Liam Glynn, Glyn, Liam Glynn. Liam is Professor of General Practice in Limerick, in University of Limerick, and he has been reporting along with a colleague on a daily basis how Ireland compares to other countries, but they're also showing in that things like, for example, the recovery rate in places like South Korea and things like that. The reality is that the majority of people who get COVID-19, irrespective of the age, will recover. However, the older you are, the more likely it is that you're to get the more serious form. But even then, the majority of people are going to make a full recovery.
A listener asks, how long does a person remain infectious to others after they've been affected with the virus? I think the figure there is a couple of days. I'm hearing, I think the answer, okay, so the 14 days isolation is to make sure that you run through the full course of it. Certainly for at least a couple of days afterwards, I would say at the moment of 3 to 5 days, but I would need to get guidance on that one myself. Part of the problem here is because this thing is so new, we're not yet at the stage where we're seeing people coming out the far side of this thing, so I don't think the information on that has caught up with us yet. Okay, now a few that are non-coronavirus related. Tralee caller, who's over 70 has just finished 5.5 weeks of cancer treatment. The muscles in her legs are sore and her right ankle is swollen. She's wondering, is this one of the side effects of the treatment, and how long does the effect of the treatment stay in her system?
Okay, again, the honest answer is I don't know, because it depends very much on the particular treatment, and even if you were to give me the name of the treatment, I probably wouldn't know the answer, because this is a very specialist area. The right answer to this is talk to the oncology nurses. They're really good and they're really helpful, and they'll be able to advise you as to the potential side effects and also how long you can expect before you make the recovery from it. I would encourage them very strongly to talk to the oncology nurses, who are really good.
Okay. An 82-year-old male caller says he's reasonably healthy, but he's feeling very anxious at the moment. Have you any advice for him?
Oh, good, the poor man. And to be fair, and the Taoiseach mentioned this last night on the radio programme, his radio address. The thing is that it is our television address. It is understandable at a time like this that people are going to be very discombobulated. as in, I mean, they're going to be very out of sorts, and understandably. And the thing about it is that's part of the reason why they're saying don't be watching news 24/7, don't be wrecking your head. Do go out and get fresh air for yourself. Do talk to people. That's probably the most important thing of all. Try and find the little pleasures in life. But people say, how can you do that if you're socially isolating yourself? You're trying to keep yourself distant from everybody else. Do it by all means possible, be it a phone call, be it if you have video facilities like Skype and FaceTime and stuff like that, or even having the conversation. My son, who lives and works in Dublin, was saying that he was out the other morning shopping, and he said, his expression was, he said he saw two old ones having a conversation at a distance of 2 metres apart.
Yeah, we do love to talk. We Irish,
yeah.
It's a very hard time in that regard as well. Now, listener says, I've COPD and I'm on methotrexate 15 milligrams. I also have rheumatoid arthritis and bad headaches. Is it safe for me? Is it safe for me to go for a walk? I'm very worried.
Yeah, the answer is, again, it's about the social distancing. The thing about it is that it depends very much on where you live. So if you live out in the country and if you can get out of your house without encountering anybody else, happy days, away you go. It's a bigger problem if you're in town, because inevitably if you walk down the streets. Now, to be fair, walking past somebody is not going to give you the infection unless they cough in your face. I think the thing is that the only problem of being outdoors, and this is really important, is be very conscious of the surfaces you touch. So if you put on a pair of gloves, if you don't touch any surfaces, especially if you go for the walk, and if you sterilise your hands, if you wash your hands when you come back in, that minimises the risk to yourself. I think it's going to be really important. It's going to be about trying to, while maintaining the social distance at the same time, it's going to be about trying to maintain your headspace as well and try not to wreck the head, because unfortunately, guys, we have no idea how long this is going to go on for, but it's certainly going to go on for quite a while to come.
Now, a listener gets in touch, and I don't know whether this person is male or female or how old they are, but the listener says, I have a sore throat since Friday. I now have a cough as well. I'm taking Diflam, paracetamol and Exbutex. I don't feel sick or anything. I'm housebound since the weekend and I'm worried.
Yeah. Okay, ring your GP, they'll organise you to have the testing done. Work on the presumption that you have the infection until proven to the contrary. You have isolated, you are self-isolating yourself, which is absolutely the right thing to do, but organise to get the testing done. You can do that by ringing your GP.
66-year-old man from Causeway said he got a very bad flu at Christmas, which went deep into his chest, and he also had a high temperature with it. He said he never in his life had anything like that. This is at Christmas, and he's wondering, could it have been the coronavirus? But this was at Christmas.
Absolutely not. No, definitely not. Coronavirus was first detected at the end of November, the end of December. It really didn't start moving over here until more recently. You know, the problem with the damn thing is that when it does touch down any country, as we've seen in every country in the world, the rate at which it increases, it just explodes in any given country. The thing about it is that there was no coronavirus around at Christmas. People didn't know about coronavirus. It just wasn't there. It actually makes the point, though, that influenza in itself is, people talk about getting a dose of the flu as if it's a thing of nothing. And for most people, what people call the flu is a thing of nothing. But if you get influenza can be quite a sickening dose. Donald Trump, God bless him, was saying, oh, this thing is no worse than influenza. And he was commenting on the fact that so many thousand people die from influenza every year. And that is true. So many thousand people do die from influenza every year. The problem with this thing is that because none of us have immunity to this thing, there is the potential there, unless we can break the chain, that the potential there is for very, very many more people to get it. Really, really, really the important thing to do is wash your hands, maintain social distancing and cough etiquette.
Listener says, if teenagers are visiting grandparents who haven't been in contact with anyone since the school finished, what is the distance required?
2 metres. 2 metres.
You're better off not visiting, though, aren't you?
No, you are actually, to be fair, absolutely, I agree with you. It really is better. You're better off at the moment. The problem is that you'd need to be 2 weeks or more since your last contact. And when did the schools break up? It was only last Thursday or Friday, wasn't it? So we're not the 2 weeks yet. So the problem is that the kids in school could well have the infection. What's scary though, Deirdre, is the fact that certainly we're seeing this, that in children and young adults, the difficulty is people can be completely asymptomatic, that's to say not have any sign of infection, but actually carry the virus on them. So I think the advice you're giving is better. Unfortunately, it's really, really hard on grandparents and parents, but I think for the time being, people will just have to keep themselves apart.
A listener asks, is it dangerous to have been on the same premises as a person who returned from Cheltenham at the weekend and didn't self-isolate?
No. Again, it's direct contact. I mean, again, the thing about it is that unless you were in the presence of the individual themselves, and it's arbitrary, but the figure is 15 minutes, so unless you've been in that person's presence for 15 minutes, and again, if you are being careful about hand hygiene, so if you've got somebody who has a potential infection, wherever they come from, if they're not observing cough etiquette, if they're not coughing into the crook of their elbow or into their tissues or things like that, if they're coughing into their hand and touching surfaces, that can leave the virus on the surface. But then if you wash your hands, you break the cycle, you break the chain.
Yeah, very good, and we can't say that often enough. A lot of people are asking, Eamon, if the virus can live on clothes. People are concerned about somebody maybe sneezing behind them and the virus gets onto their jumper or whatever.
The answer is that it survives better on hard surfaces than soft surfaces, but my understanding is that normal washing will actually kill off the virus.
Okay. Listener asks, is wearing gloves advised if you're working in retail, and if so, are surgical gloves okay?
Yes, they are, and I'm seeing a lot of retail outlets are doing exactly that, giving their clients, their employees gloves, and that's a fair point. Now, to be fair, the thing is that you've got to be careful, though. The thing is that if you come in contact with something that is potentially infected and it's on your glove, if you then transfer that glove to your face, if you rub your eyes or nose, or you can then transfer the virus from the outside of the glove into your body.
Okay, a listener says, would somebody with chronic sinus problems be at risk with COVID-19?
Not particularly. It's the chronic heart, lung and kidney conditions. Unless you have an underlying lung condition, that's the thing that would put you at greater risk.
Now, this next question is very understandable, but I'm not sure how you'll answer it, Eamon. It's a person who is the only carer for elderly parents, and they're worried that if they get COVID-19, they won't be able to isolate themselves because their parents are dependent on them.
Yeah, and these are the really hard ones. The answer, I think, unfortunately, is that for that individual, they're going to have to take even more care in terms of trying to protect themselves, which may very well mean not meeting anybody else. Now, under those circumstances, you'll say, well, how the heck are we going to get messaging sorted out? How are we going to get the groceries and stuff? I think, again, then we'll be looking to the common decency amongst individuals. If you have friends, if you have relatives, if you have anybody who can, for example, get the groceries for you, leave them outside the door and bring them in. In other words, you need to isolate yourself so that you don't get sick, so that you in turn are there to look after your parents.
Now, we'll just maybe take two more briefly, Eamon, because I don't want to keep you too long. I know how busy you are. We've a male caller from Tralee. He's 66 and has an appointment with his surgeon tomorrow after waiting for 2.5 years. He wants to know what precautions he should take to protect himself and others while attending his appointment.
I think first and foremost, ring ahead and check to make sure that the appointment is actually going ahead. That's the problem. That's the sad bit, Deirdre. The difficulty is that unfortunately a lot of routine work is going to be stopped. So I'd suggest in the first instance that he would ring ahead. Now, having said that, after that is just the normal precautions. What the clinics will be doing is spacing people 2 metres apart, using lots of hand gel and so on. For people to remember to bring tissues with them. Yes, I know I'm not trying to be funny about this thing. I know there's been a fierce run of toilet paper and the rest of it, but I can't stress enough. The thing is that people use tissues to cough into, tissues or handkerchiefs which you can wash, whatever, something like that. The reality is that we are going to run short of face masks. That's the problem. That's the reality. There just isn't enough supply in the entire world right now. And the thing to do is for people who bring tissues with them. But having said that, before you even start talking about that, check first with the hospital, make sure that they are actually running the clinic tomorrow.
And finally, Eamon, a lot of people again asking this question. They're looking for safe guidelines when they're going to the grocery, to the supermarkets. Should they wear gloves? Should they use gel? Should they remain as far back from other people?
Yeah, that's exactly it. And again, I can't stress this enough. If you go to the HSE website, hse.ie, right at the top there is really good advice on coronavirus, and there's more specific advice. Like, for example, on the HSE website, there's a thing called Protect Yourself and Others, and there are things there about social distancing. There is specific advice: keep a space of 2 metres, reduce interactions with people outside the workplace and home, reduce the number of people you meet every day, avoid communal civic areas, avoid crowded places, work from home if possible, don't shake hands or make close contact if possible.
Okay, so plenty of advice there on the HSE website. Eamon,
absolutely.
We'll leave it there. I know you're extremely busy, like everyone in the medical profession is at the moment. And thank you so much for giving up some of your precious time to be with us as always. And we'll talk again next week.
Cheers, God. Take care, everybody. Good luck now.